I'm Kavita Chauhan. I'm a principal consultant at Oxford Policy Management. We are a research and development organization, and I work on health, and I'm based in New Delhi. So at OPM, we generate evidence, we work across the policy cycle, we synthesize evidence, and we aim to influence policies and programs for public health. And for me, solidarity is about acknowledging that research is about interdependence, a shared understanding of the issues, a mutual understanding of what the barriers and facilitators and opportunities are, and an intent to work collectively towards those issues. In our work, we work with communities, we work with policymakers, we work with stakeholders, which includes civil society groups, community-based organizations, and we're engaging with them to generate evidence, to make it more relevant, which can be used to influence or shape policies, build discourse around important public health areas, or raise the discourse on issues which merit attention but maybe are not getting attention. So we really engage a lot with the stakeholder community. And I think an important part of our research is to collect evidence data, which we do through communities. And I believe that is the first-hand experience of us, expressing that solidarity, where we look at problems, look at issues through the lens of community. And we often engage enumerators who also are from the same community, so that we are able to build a more real understanding of those issues and problems. I think what solidarity means to each one of us may depend on our own understanding. It may also depend on where we come from, which position we stand at. And so, I may feel solidarity for a certain issue, but if I'm in a position of research and working on a certain issue, then, of course, my institutional framework would allow me to support or show solidarity with a specific issue. But I think solidarity truly is about that interdependence. It is about understanding that we don't exist in isolation. So it's not us and them, it is us as people. And, as a researcher, I often think, we collect data from communities, but we do owe it back to them. We owe to share results with the community. I mean, they have to be part of the process from the beginning to the end. And also looking at, how do we translate that evidence that we've generated into something, which supports the well-being of people. So for me, it's actually, there's no linear definition of what solidarity means, but I think it is about, that interdependence, acknowledging that interdependence and working in your own way towards it. In our work, in my current work and past work, the research that we generate, the insights that we draw out of that research, we are kind of using those to shape programs and policy, which may be just one step. So as an organization, we are playing our part, but we are also part of an ecosystem. And within ecosystem, there are different constituents, there are different organizations. And I think true solidarity is when those different constituents in an ecosystem work together and take it up as a collective responsibility, as a shared goal. I think that is the true, in my understanding, that's the true essence of solidarity. So I think the workshop has been really interesting in bringing really diverse perspectives. And also, I think it has challenged some definitions and understanding of solidarity. And I think one thing is really clear: there's no one definition or a linear process of, organizing efforts towards, solidarity in public health. And it's that difference, that this workshop acknowledges and brings forth, which is really important, because I think the workshop significantly builds an understanding in the public health community about what solidarity in public health is.